Hi, I'm Dr. Angela McKaye, chiropractor and naturopathic physician, and we are talking about SIBO this week. So SIBO stands for Small Intestinal Bacterial Overgrowth, and the symptoms of that are things like bloating, gas, either burping or tooting, cramping in the abdomen, constipation, diarrhea, combination or alternating of both constipation and diarrhea. You can have nausea, joint pain, food sensitivities, rashes, eczema, anxiety, depression, and brain fog. So all of those things are possible when you're having SIBO. So obviously all those things don't necessarily add up to mean SIBO, but they can be a part of that. So you want to get checked out. And if you're dealing with chronic, constant digestive issues, indigestion, you've got to be really picky about what you can eat because you know it's going to come back to get you later if you eat something that's not on that approved list for you. Then you really want to get that checked out and taken care of. It cuts into your family and social life significantly. So like if you're at a birthday party, maybe you can't eat the cake or you can't eat what's served someplace that you're going, or you can't join in with everybody else in the activities that they're doing. And food, so much of our social life revolves around food sharing, enjoying food together, enjoying a meal together, that it really can feel like you're missing out if you're having these issues. So if you've got these things and you've gone to your regular primary care doctor, if you're lucky, they maybe have said something like, oh, it's just IBS. It's just, it's stress, cut your stress. I've heard that from patients, or increase your fiber. And sometimes that's not a great idea because these intestinal bacteria that are living where they shouldn't be digest certain fibers, and that causes more gas and more bloating as they metabolize that fiber that they use for food. Adding more fiber, depending on the type of fiber you're adding, can make your symptoms worse. So just adding more fiber is not necessarily going to cut it. It may actually exacerbate the situation. Some doctors may have told you to start a low FODMAP diet, and you're like, what the heck is that? Maybe they gave you a handout. Maybe they just told you to do a low FODMAP diet and left you on your own to sort of figure out what that actually means. And there's a lot of great resources on the internet, but if you don't know where to start or where to go and you don't have any support, that can be a big challenge. And in and of itself, the low FODMAP diet is helpful if you have SIBO, but it is not necessarily going to be the cure, and it's not a fun diet to stay on long term if you really don't have to, and there's another option. Sometimes if you've seen your regular doctor, maybe they've put you through a colonoscopy or an endoscopy, and they say everything looks great, and so they've taken the steps necessary to rule out some of the big things, but not really giving you any sort of tools to deal with the symptoms that you're experiencing. Definitely with SIBO, because of that inflammation at the cellular level, there is some leaky gut happening. Now, whether leaky gut was the thing that started it, that may have been the start of the SIBO, but it also may be a result of the SIBO. So either way you go, you may find that you're having food intolerances, not just with getting symptoms like the nausea or the gas or the bloating, but you may be having other symptoms like we talked about, the rashes or things of that nature, where things are passing through the membrane of your GI tract that shouldn't be. The bugs that you may have or the bacteria in small intestinal bacterial overgrowth, you can have pathogenic bacteria or you could have even good bacteria. It's just in the wrong place. So you're supposed to have a good microbiome, a good bacterial flora in your colon. That's where your gut bugs should be living. They shouldn't be living in your small intestine. And so when they come up further into the GI tract where they're not supposed to be, that's when they start causing some significant problems, even if they're not necessarily a pathogenic bug. These bugs in the small intestine start to metabolize the food that you're eating there, and so they're eating what you're eating, and they start to digest that, and they start expelling their own gas and waste and everything in your small intestine, and that's why you get that bloating and discomfort there. You don't have the same type of pain reception in the GI tract that you have in other parts of your body, so usually when you experience GI pain, it can be due to stretch, too much stretch from that gas and bloating. It's just causing a stretch on your small intestine that leads to that pain. These bugs really love starches, they really love sugar, they really love, like we talked about, soluble fibers, and so you have to be careful about what you're eating because you don't want to give them stuff that they love to eat, because then they just have a party and it's not a party for you. You're left having to do the cleanup metabolically. The most common cause of SIBO is food poisoning. So if you've ever gone out and had some questionable food and then had traditional food poisoning symptoms 4 to 6 hours later, vomiting, nausea, diarrhea, those things, your body's trying to get that bad bug out of your system any way it can, that oftentimes is the first sign that you are going to potentially end up with SIBO. Now, not everybody that gets food poisoning gets SIBO, but it is the most common way to get SIBO. And the good news is that when it's food poisoning and you're never well since that time that you had whatever it was that gave you food poisoning, that often, if we take care of it early, can be the end of the story there, and you can go on and not have any further troubles. We talked about a case earlier this month in a young woman who had food poisoning at Thanksgiving, and she and her mother-in-law got sick. Her mother-in-law recovered, but she didn't, and she'd never been well since then. We did one round of treatment for SIBO, and so far so good. She hasn't had any recurrence. However, there are other things that can lead to SIBO, and there's a long list of conditions that can predispose you to having small intestinal bacterial overgrowth. Some of those things include low thyroid or hypothyroid. That can also be things like hypermobility syndrome or Ehlers-Danlos syndrome, Lyme disease, other autoimmune conditions that slow down the nervous system, because anything that slows down how quickly your food goes through your GI system can lead to small intestinal bacterial overgrowth. Other things that can be problematic are low stomach acid, and some of the symptoms of low stomach acid are very similar to the symptoms of high stomach acid or too much stomach acid, and that can be heartburn or GERD or indigestion, burping, some of those things, reflux. So those things can be a sign of either too much stomach acid or not enough. Typically, as you age, you make less stomach acid, and the less stomach acid that you're making, the less you're digesting your food before it moves along in the GI tract. It changes the pH, and this lower pH makes a nice environment for gut bugs to be where they're not supposed to be. We talked about stress when we talked about food hygiene or eating hygiene, and so you want to be in the rest and digest mode. If you're stressed out, if you're in fight or flight, you're not going to be secreting stomach acid, and you're not going to have the appropriate stomach acid that you need to be able to digest your food. So that is one thing that can be really important in terms of avoiding SIBO, and during the recovery process, really you need to pay attention to sitting down and getting into a rest and digest state to help you be able to recover long term. Now, the testing, if you think you have SIBO, if you've got all these symptoms, you've ruled out inflammatory bowel disease, you've ruled out H. pylori, you've taken a look at the pancreas function, and your doctor's like, well, I don't know, it's just stress, maybe just, try eating more fiber or try a low FODMAP diet. The testing for SIBO is pretty basic and straightforward. You drink a substance called lactulose. It's unfortunately, or fortunately, a substance that the gut bugs in the small intestine love to digest, and so they will take that in. It's a sugar, and then they will start to metabolize that. After you get that into your system, you take a baseline breath test before the lactulose, and then you breathe into these tubes at regular intervals, and you're looking to see if you're off-gassing through your breath coming up through the esophagus, through the mouth, if you're off-gassing any of the typical gases that these gut bugs like to excrete. So I usually do a 3-hour breath test to see if those levels rise, and that gives us a clue about which bugs are involved. So the gases that we can look for in that are both methane and hydrogen. Now, there are other kinds of SIBO that you can have that include hydrogen and sulfide, and there's not a great test for that, but usually on that same breath test, you'll have all the symptoms of SIBO, everything else has been ruled out, but then the levels don't rise at all. You just have a flat line, and none of those gases are excreted. You can also have small intestinal fungal overgrowth that can cause all the same symptoms, and you wouldn't necessarily be able to see that on this test. But if you've ruled everything else out, then that is where you should probably focus next. It's important to remember, like I said, that like about a third of people will have SIBO, maybe from food poisoning, because that's the most common cause, and then they recover really nicely with one round of treatment and then go on their merry way and don't have any problems. However, about 2/3 of people who have had SIBO for a long time, or they have some of those underlying conditions that we talked about 2/3 of people have a relapse, or they need multiple rounds of treatment to rid themselves of the condition. And so that can be something worth knowing, so that you don't get discouraged if you happen to fall in that group of 2/3 people and think, well, I did the treatment and I'm still having issues. Just know that that's typical for some people, and one round maybe was not enough for you to get rid of all of the gut bugs. Treatment includes antibiotics, and there are certain antibiotics that just release in the gut, so you don't get the systemic side effects of the antibiotics. And then I also recommend herbs with that, because the research shows that herbs are as effective as antibiotics, and they rid SIBO over 85% of the time, one or the other, and at about the same rate. But if you combine them together, then your success rate goes up into the mid to high 90%. So you have a much better chance of getting rid of the gut bugs if you combine the herbs with the antibiotics. So if you've been frustrated with your symptoms and and the care that you've gotten up to this point and haven't really gotten a solution, and you're still dealing with all of this indigestion, it's really important to get in and get treated by somebody who knows what SIBO is. It is totally treatable, and it can oftentimes go away completely, or at least be improved so significantly that it's completely manageable and not upending your life. So make sure to get in and get seen with somebody who's qualified and knows what they're talking about when it comes to SIBO. If you have any questions, drop them in the box and I'll be happy to talk to you again soon. It is Testimonial Tuesday. We're talking about SIBO this week, and we did already talk about a case with a young woman who had SIBO previously and how she was successful treating SIBO after about a food poisoning. But I want to talk to you about a case now that was just a little bit more complicated. So I had a woman in her mid-40s who came in, and she has low thyroid, so hypothyroidism. And because of hypothyroidism, it slows down your metabolism a little bit. So that migrating motor complex that we talked about, that doesn't move as quickly. So digestion can be a little bit slower when you have hypothyroidism. So that lets food sit in the small intestine longer, which makes a perfect environment for little critters to find food and hang out and have a pretty cushy lifestyle if that's not remedied. This person also had some higher histamine levels. So she had MCAS, which is mast cell activation syndrome, and mast cells live in your skin, in your respiratory tract, and in your GI tract. They're kind of all over the place, but they're in high concentrations in those tissues. So their job is to hang on to histamine unless there's an invader, and then they'll just go throw a lot of histamine at it. And histamine also makes things leaky so that repair cells can get to the area of injury and start cleaning up whatever foreign invader has gotten in there or whatever mess there is to take care of. So in addition, she had that as well, which meant that she had some leaky gut and some other things going on. For her, we did 1 round of antibiotics with rifaximin. That is an antibiotic that stays local to the GI tract. So it goes into your small intestine and it hangs out there and does its job there without having to necessarily go systemically. So you don't end up with a lot of the side effects that you can get with other antibiotics of systemic side effects. So that is a really great antibiotic. There's been lots of research on it to show that it's very effective at treating SIBO, but it is still relatively new and expensive and can be difficult to get insurance to cover. So for that reason, we only did 1 round of antibiotic with her, and we did 1 month of herbal antibiotics. So that was a combination of herbs, and it includes herbs like berberine, which has some crossover with some Chinese herbs. So there can be some really great Chinese formulas that can help with this as well. But we use naturopathic herbs in her case. So we use berberine, oil of oregano, some garlic compounds that were high potency garlic, as well as some prokinetics. And prokinetics are things to help the digestive tract move a little bit more smoothly, a little bit more regularly, and support motility through the GI tract so that food's not hanging around in the small intestine for too long, as well as changing her diet. Now, in her case, she did a low FODMAP diet. That is not the only diet for SIBO. There are different diets available that can be really helpful, and different things work for different people. She did really well with the low FODMAP diet, but there's also a specific carbohydrate diet. There's also paleo that I've had some people do really well with, or ketogenic diet that I've had some people do well with, and there are other diets out there. So just know that you don't have to be restricted to one. What worked for somebody else may not be what works for you. In her case, we ended up doing a 2nd round of antibiotics. She had been sick for like 17 years with this, and so she had this going on for a long time. So it wasn't reasonable to expect magically 1 round of antibiotics after 17 years was going to fix everything. So we ended up incorporating more food after the 2nd round of antibiotics, and then so she did an additional month of antibiotics, and then slowly started introducing food again, and then started having more symptoms. So she found that when she sort of fell off the wagon with her diet, symptoms came back. So then we had to do a 3rd round of treatment, and we did rifaximin again and another round of herbal antibiotics, and then slowly came off of that and started reintroducing food again. And she found then after that she was able to expand her diet quite a bit and eat most things. But if somebody had a birthday party and she got a little too much cake or went a little overboard, she would have symptoms, and then she would just revert back to the low FODMAP diet for a day or 2, and that would be enough to keep her back on track. So she was able to expand things and have a mostly normal diet most of the time. And during the course of the 2 years that I treated her, she only had 1 or 2 relapses during that time that were really short-lived, that she either took care of herself by just reverting back to the low FODMAP diet or doing a couple weeks of the herbal antibiotics and getting back on track that way with very minimal intervention and very minimal symptoms. So it didn't ever blow up, so to speak, no pun intended. In her particular case, due to the underlying factors with the hypothyroidism and the hypermobility syndrome, she has a situation where she kind of has to keep an eye on it the rest of her life, but she's in a place now where she's able to manage it, able to eat what she wants. She doesn't have to stay strict on any particular diet. She's tasked to be aware of which things she can have, how much she can have. So it's not that she can't eat birthday cake, it's just she has to be careful about how much of it she consumes, and just be able to live with a little bit of moderation. And she also has the tools that she needs at this point to regulate that herself should she start to have symptoms again. She's one of those 2/3 of people who may have repeat recurrences versus the 1/3 who get treated once and then they're totally fine. But she's completely happy with her level of symptoms and ability to be in control of her symptoms now, that she doesn't have any periods of feeling absolutely miserable anymore. She's super happy not to have the bloating, the gas, the nausea every single day. So for her, that's worked out great, and she's doing fantastically now, probably 3 years out since the first time I saw her. So just know that it is possible to feel better if you find a practitioner who knows what they're talking about with SIBO, and can help guide you the way to get there. It's time for Wake Up Wednesday. I'm Dr. Angela McKaye, chiropractor and naturopathic physician. We're talking about SIBO this week. A lot of people with SIBO practice intermittent fasting, and you don't have to practice intermittent fasting, but one thing that can be really helpful in getting rid of gut bugs is not just grazing all day, because if you're grazing all day, you're exposing a source of food to your gut bugs that they can just sort of metabolize all day long, and then you end up with more symptoms. So intermittent fasting can be really helpful because that's a period of fast for the bugs too, where they're not getting any nutrition, and that disrupts their life cycle. So it can be very beneficial. And if you've had SIBO for a while, you've probably noticed that when you wake up in the morning, you feel better, and then by the end of the day, you've got a lot more bloat, a lot more symptoms as this day has gone on, as you've been feeding those gut bugs whatever you've been eating, they've been eating. So I do recommend intermittent fasting to some extent, or at least having 3 solid meals a day that fill you up and not eating or snacking in between. When you're talking about SIBO for breakfast, I did a really quick Google search of SIBO breakfast and got a ton of different things that can be SIBO friendly to start your day out with. So some of those things include overnight oats, which we've talked about before with chia. And I love chia because chia has a slippery quality to it when it's been wet for a while that is very soothing to the GI tract and the gut lining. So that can be a good source of nutrition if you're tolerating the fiber in the oats. Frittatas is another thing. If you're tolerating eggs and sulfur isn't giving you a hard time, so you're able to eat eggs and onions and garlic, that can be a great way to start, especially if you're on a paleo or a ketogenic diet, and you can put lots of different things in there that can be really tasty for breakfast. Same thing with scrambled eggs. And if you're not tolerating eggs, you can try checking to see if it's the egg whites that are problematic or if it's the yolk, and see if that makes a difference for you too with your symptoms. I really love soup in the morning as an option. I've recommended congee in the past, which is like a rice porridge. Oftentimes I'll make that with bone broth, but people with SIBO don't necessarily tolerate bone broth, especially if it's long cooked bone broth, because of those mast cells that we talked about in the prior video. If you are really sensitive to histamine, long cooked bone broth is a high histamine food. So if you're really reactive, then that may not be the thing for you. But if you put things into a soup for the morning that is just basic chicken broth that's not bone broth, that can be lower histamine, and so people tolerate that generally pretty well. Rice, if you're not doing a ketogenic diet and you can tolerate grains, can be a pretty neutral food for people to have in the morning. So in that sense, rice porridge or congee can be really beneficial for people to have something nice and warm and soothing when you wake up in the morning for breakfast to break your fast. And it is Tactical Thursday, so I'm going to give you some tips that have helped a lot of my patients deal with SIBO, because that's what we're talking about this week. So one of the most important things from the outset, make sure that you're ruling out all the other stuff and that SIBO is actually what you're dealing with, because you're not going to get better if you're treating the wrong thing. When you have a diagnosis of SIBO, you want to make sure that you're preparing. So probably one of the biggest things with SIBO is that you have to switch your diet into something that's not going to feed the gut bugs. This requires some planning. So you have to meal plan ahead, you've got to shop ahead, and you've got to be prepared with the appropriate foods so that you're not getting hungry and uncomfortable and then going off the diet and allowing those bugs to sort of get the fuel they need to have a nice bloom in your GI tract. So some planning has to go into it so that you have the appropriate food to fuel you and not your bugs. One thing that can be really helpful is something called the SIBO app, and that's just the name of it. So go to your app store. You should be able to find the SIBO app in either of the app stores for those. You want to pick a diet that seems like it's going to work well for you. So we've listed some of the diets available, and go through the foods and pick out the things. By now, if you've had this for a while, you're going to know kind of which foods set you off and which foods you tolerate better. So you can go through the different food lists in each diet and pick foods that seem to be more in line with with what you tolerate well at this point. There is a colleague of mine who has the website SIBOinfo.com, and that's SIBOinfo.com, and Dr. Seebecker there has all the different types of diets that are recommended for SIBO, and she'll have pretty extensive listings. Sometimes she cross-references them so that you can see which foods are in common for each thing, and that can be really helpful when you're trying to decide which diet to follow. As you're going along on this process, it may be early on very tempting to stick with a few foods that you know upset you the least. And I found that that's how people often start, and they're afraid to incorporate any more foods from the approved list within their diet. And they come in saying, I'm so sick of chicken and white rice and broccoli, or chicken and white rice and whatever. So I encourage you to explore as many different foods as you can on the approved food list for the diet that you're on. So get creative, have some fun. Probably up till now, food prep and eating was just nothing but stressful because you knew you were going to have symptoms. But as you start to feel better, start branching out a little bit within what's approved for your diet plan and seeing what you can tolerate and getting as much variety as you can so that you can enjoy eating again, hopefully without having symptoms. Along with herbs, I almost always recommend a prokinetic. So something to keep the food processing going along down the tube the way it's supposed to. Sometimes this can be as gentle as ginger tea. So ginger is antimicrobial, it's antiviral, and it works as a prokinetic. It can be anti-nausea as well. And so it may not be enough for some people with SIBO, but if you like the taste of ginger, it can be very soothing, both to your GI and to your psyche. When you're going through this process, know that the die-off from treating SIBO, that killing off the bad gut bug thing, takes anywhere from 6 to 8 weeks, and it may take that a couple rounds. So once you get through that die-off phase, it's really essential. You can't just kill the bugs and then move on with life. You need to go through a healing phase. So you're building up the lining of the gut, and you're doing everything you can to heal the tissue there so that you don't have a recurrence. And that lasts another 2 to 3 months. That's about 3 months is about how long it takes for the cells of your GI tract to turn over. And then from there, you have a maintenance phase, which can be anything from like, woohoo, do whatever you want, to really just monitoring and expanding food very gradually and seeing what you tolerate and how much, and coming up with a lifelong plan that allows you to eat as many different varieties of food as possible. All right, I hope that gives you some guidance for treating SIBO or living with it, and I will talk to you in the next video. And it is Friday favorite day. We're talking about SIBO this week, and I've already touched on some of these things already for you, but I love ginger tea. Talked about that in the last video, and it's antimicrobial, it's antiviral, it's great for this time of year when colds are starting to circulate around. In traditional Chinese medicine, there's an acute cold flu sort of treatment where they just take off 3 slices of ginger, boil the heck out of it. When you start to get like cold or chill or feel like you're coming down with something, wrap up in a warm blanket and drink that hot ginger tea. The way they make it is to put in enough brown sugar to be able to taste it, and they boil the heck out of it so it's super spicy hot. I don't recommend the sugar because if you're having SIBO, that's just going to feed the gut bugs, but sweeten it as little as possible, or just don't boil it for so long. Just get that nice warm ginger flavor. You can also just get ginger tea off the shelf already in a tea bag and ready to go, and just steep it a little bit extra. Some other things that improve digestion that we haven't talked about that sometimes can be very helpful for SIBO are increasing stomach acid, because remember, if you're stressed out, you're not making as much stomach acid, or if you, as you get older, you make less stomach acid. So you want to increase the acidity of the stomach acid or the volume, and you want to have that available to help break your food down and also act as an antimicrobial, so that when you pass it on to the duodenum and the small intestine, it has the proper pH for that to work on, and promotes a situation where you're not going to grow extra bugs. So one of the ways to do that is with apple cider vinegar. You don't want to drink it just straight, because I don't want it to irritate your esophagus going down, especially if you've had reflux. You can have a lot of burning there and irritation of the lining of the esophagus, and we don't want to aggravate that at all. But apple cider vinegar, you can use it as a dressing on your salad, or you can take it with a tablespoon in a 1/3 cup of water. If this aggravates your symptoms at all, stop, because you may be one of the few people that has too much stomach acid. And then the other thing that can be helpful is digestive bitter. So there are a lot of bitter herbs that can help with the secretion of bile and stimulate digestion that way, that you can take before meals to help digest your food. And then really one of the most important things all around that you can do is stick to the food hygiene. So we talked about that before in previous videos, but you really want to get into that rest and digest state so that you are centering yourself, breathing, getting into as much of a parasympathetic state as possible and out of that that fight or flight state, because that's where you're going to be able to digest. If you can't get into that rest and digest state, you cannot digest your food properly. That also includes chewing really well, and taking the time to eat, not eating at your desk or in front of the computer or while you're doing something else, walking around the kitchen, but really sitting down and having a nourishing meal and focused on eating, chewing, and absorbing what you're eating. So that's it. Give those a whirl and stay well. I will talk to you soon.